Good morning, everyone, and welcome to another episode of Coronavirus TV. Last week, we discussed the use of immunology drugs in the treatment of coronavirus complications, such as pneumonia and acute respiratory distress syndrome, and this week we're going to be discussing the testing of coronavirus. I'm sure we've all heard about the rate of testing around the world and the need to increase testing in the UK. So today we're going to be discussing why testing is needed, what type of tests are available, and the current state of testing around the world, particularly in the UK. Testing is widely considered to be vital as part of any pandemic response. It enables the identification of individuals who have been infected and thus can dictate policy issued on things like social distancing, isolation, and quarantine. It can also be really valuable in a primary care setting, increasing the efficiency of things like patient triage and really helping to identify where resources are needed and helping them be delivered there as required. There are two major types of testing that are around at the moment, and these involve PCR type testing and antibody-antigen type testing. PCR type testing is used as a diagnostic tool to identify individuals who are infected with the disease and looks for viral genetic material, whereas antibody or antigen type tests are used to identify whether an individual has been infected previously, including historically, and involves testing for virus-specific antibodies or viral antigens themselves. So there are advantages and disadvantages to both types of testing here. So we'll start with PCR. PCR is reliable and highly sensitive. It's able to identify infections in their early stages, as well as in cases where there is a low viral load. Also, PCR has existed for a number of years, and a framework exists within the UK for PCR testing to be incorporated. Individuals, laboratory technicians, testers, and those working in traditionally wet environments are familiar with PCR, and it wouldn't require the introduction of a new technology. However, PCR cannot be done remotely, and a lab is required. And this really limits where testing can take place and how frequently testing can occur. As a result of the fact that PCR is the dominant testing type, there is a major shortage of reagents required for PCR, such as primers required for the PCR reaction to take place. There's also a lack of positive controls, and this is leading to a further lag in testing times. And compared to newer antigen antibody type testing, PCR testing is slightly slower. So as I mentioned, antigen antibody types testing can be used to identify individuals who have been infected in the past, including historically, and looks to identify virus-specific antibodies or viral antigens themselves. This is really, really useful and can be conducted remotely, a major advantage to this type of testing. All you would need is a small testing kit which could be transported. In the future, it's hoped that this type of testing could also be used to identify individuals who have been infected but are now safe to re-enter a population as they have gained immunity. Questions still exist over the possibility of using this type of technology with coronavirus. Questions still remain to be answered about whether reinfection is possible and how long-term protection and immunity is gained. However, antibody-antigen tests are low in sensitivity, and both the UK and Spain have been forced to shelf millions of kits after prematurely ordering them prior to formal testing, and they failed to show sensitivity in cases of mild infection or early stages of an infection. So there are positives and negatives to both types of testing, but currently PCR remains the dominant type of testing here. So what's the state of testing around the world? As I mentioned, antibody-antigen type testing is unreliable. No G7 nations have authorized mass testing using antibody-antigen tests. And even within this, the global state of PCR testing varies greatly. The UK currently sits towards the lower end of the spectrum, testing around 350 per 100,000 individuals in the population, with South Korea and Italy testing around 900 individuals per 100,000 of their population, and Germany leading the way for developed nations with around 1,100 individuals being tested per 100,000 of their population. So why is the UK testing less than other countries? Well, testing wasn't a priority of the UK government during the early days of the pandemic. Initially, just 8 laboratories were assigned for testing, which rose to 48 after a government appeal looking for laboratory help here. Currently, 220,000 people have been tested in the UK, with NHS staff being prioritised but not guaranteed a test. There are now global shortages of testing kits, and this is really causing a problem, as the UK has been unable to get tests to all of those people who need it. An example of this is healthcare professionals. As I mentioned, NHS staff are not guaranteed a test, and this can have a real domino effect. Healthcare professionals showing symptoms will be recommended to isolate, but without a testing kit, it's unknown whether they in fact are infected, and if they are not, it's a wasted resource from where they could be helping treat other infected individuals. On the other hand, countries such as South Korea and Germany responded very rapidly to the pandemic, and stockpiled testing kits, leading to both countries having above double the testing capacity of the UK. A number of existing public-private collaborations in Germany have meant that the government were able to call upon double the lab resources of the UK, really aiding their rapid response to the pandemic. But we are catching up. The UK government has recently increased the priority of testing during the crisis, including an appeal to businesses to contribute to the testing capacity by providing manufacturing or supply chains for swabs, vials, reagents, and other equipment that is vital for testing to be carried out. The government aimed to be delivering around 100,000 tests per day by the end of April, and industrial entities such as Thermo Fisher have committed to helping the government meet this figure. And if this can be met, we hope leads to a real levelling off and eventual decline of that infamous disease curve. Thank you very much for listening, and we look forward to seeing you on the next episode of Coronavirus TV. Goodbye.